So Doc, from your understanding and knowledge, what is the cause of rheumatic diseases?
They are the autoimmune inflammatory disorders. The autoimmune which I was talking about, the body is fighting itself and it manifests in the joints. Yeah. Now what triggers off that abnormal defense mechanism is not known. Yeah.
So Doc, if this is the case, is there hope for a patient with suffering from these diseases?
There is a lot of hope for patients who have rheumatic diseases. The thing is to find help early. Early means within the first 2 months of realizing that something is wrong. And that realizing something is wrong is not always the joints. It can be the skin. That's also somewhere where problems occur, because again, it's in skin you will see a dermatologist. And I normally say there are some diseases which are not skin deep. They are deeper than the skin, like these autoimmune disorders. If they attack the blood itself, connective tissue, which is the blood vessels, the muscles, the internal organs. So as somebody is dealing with your skin, something is chewing your kidneys or the blood itself. Maybe some components of the blood, like the platelets, have been eaten up by the autoimmune process. So you may end up starting to bleed uncontrollably just because of the autoimmune process. There is hope if you seek the right treatment early. And that's what I was saying, if you are diagnosed within the first 2 months. But I'm not restricting it that you must wait for 2 months. I'm just giving it that the earlier, the better. Like in rheumatoid arthritis, if you are diagnosed early, you are likely to respond even to medicine better, leave alone not developing complications. If you are diagnosed early, you are likely to avoid developing complications. But also it has been realized that if you are diagnosed early, when you are started on medication, you will respond better and your disease will go quiet, better than somebody who is seen later. Maybe because they waited taking self-medication from the chemist, or they went to somebody else who did not realize that they needed to be treated the right way. So the later, the worse outcome. The earlier, the better. But there is a lot of hope. We have medicines which are able to tackle most of these diseases and put them in a quiet position, what we call remission. The disease can be put to be quiet using medication and remains quiet, and you lead a normal life taking medication.
So Doc, if this is the case, would you categorize this disease as a terminal ailment? Is this a terminal disease?
No.
Why?
Because if it is, most of them, if they are managed properly, it's not that they will kill you. You will die of some other things. You will lead a normal life and die of some other things.
You know, in Africa, there are many herbalists. So would you recommend one seeks treatment from a herbalist?
Having the kind of knowledge I have about the problems, I would not think that going to a herbalist is the best way to go. I'm not a herbalist. I've never studied herbal medication, so I can't speak for herbalists. But from what I know, I would not direct you otherwise.
So let's talk about diet. How does diet contribute to either prevention or getting the disease?
As we will look into various diseases, we'll see those which have got relationship with particular foods. There are some of them which have got relationship with particular foods. The majority don't. But of course, a healthy diet is a panacea, is a solution, a preventive measure for almost all the diseases. Say a healthy diet. So that is a universal good thing. Yeah. So if you look at it like that, a healthy diet is good for everybody. But there are some of these diseases which have got particular diets which will make them worse, or which will trigger them, which will handle as we continue in specific diseases.
So are there foods or drinks that one should avoid, either when you have the disease or as a preventive measure?
If you drink in an irresponsible way, then of course you are not going to take your medications the way they are supposed to be taken if you are on treatment. Yeah, and so the response may not be great. But also there are particular arthritis conditions which are associated with alcohol and some particular diets. But like I'm saying, when we start dealing with specific diseases, then we now go into those particular diets and which particular disease conditions. Okay. Yes.
Is the disease expensive to manage? What do you think from your experience?
Yes. That one I'll answer you without thinking twice. Yeah. First, seeing the right doctor will be expensive. Okay? Yeah, because you will find most rheumatologists, to see them, you will find you have to pay some consultation fee. And these are chronic conditions which will need regular follow-up. The most expensive part of them is the medications. Because we can say right from investigations are expensive, but investigations, the diagnostic investigations are a one-off kind of thing. Diagnostic investigations of rheumatology conditions are some of the most expensive in internal medicine. Those autoimmune tests, the tests for autoantibodies, they go up to something like 30,000 to diagnose those autoimmune conditions, the diagnosis alone. Then now you will now go to medications, regular medications. Also, there are some which are very expensive, so that we'll find that a patient maybe in a month is using something like maybe around 10,000 shillings or more to buy medication in some cases when the disease is difficult to treat. When they have become quiet, then it might be a cost around 5,000 per month to treat some of the diseases. And because they are chronic, they are costly. They are not cheap.
Now, if that is the case, do you think that there's something that the government, especially in Kenya, can help to reduce such heavy costs?
I think there are a lot the government can do to help. Look, let's start with the diagnosis. At Kenyatta National Hospital, you will find it's a government institution and it's the apex. You will find that they don't have the capacity to do a number of these autoimmune tests, so that even when we see a patient there, the patient has to go to a private hospital. The best known one for the autoimmune test is Lancet Laboratories. So you'll find the patient has to go there with the kind of amount of money I'm telling you about. So you see, you start by going to a public hospital because you are financially down, and then you are sent to go and do investigations which are very expensive. So if first of all, if those laboratory tests, the autoimmune tests, the government can make them available in every county hospital, that will be a good beginning. Okay? Or even maybe you start with provincial, the national hospitals, then go down, you make them available. That would be a good beginning. But also, the other thing the government could do is to stock the medications. Because you may find that like now, people are using NHIF in public facilities. But the NHIF system, patients will be contributing to it every month. But when you go to the health facilities where they refer you to, those medicines are not there. Or if they are there, the allocation to that health facility cannot afford you the medication. And I think it's something which can be sorted out very easily if the government is keen on sorting it out. Because with the NHIF, the government should be able to make these medicines available in the health facilities where you are referred to. There's no use referring somebody to a facility where there's no medicine. It's of no use. Yeah. So there's a lot the government can do in making the medicines available. And then now, because there's the diagnosis, then there's the medicines, then there's the follow-up laboratory tests, which are also done to check how is the disease doing and are there any side effects of the medication. So there are some medications which are on them for these autoimmune disorders. You have to be done laboratory tests at least every 3 months throughout. Okay? So those are costs. And it means then now you have to see the doctor every 3 months. So if there could also be a system whereby you see a rheumatologist from time to time, but after seeing the rheumatologist, you are referred back to your county to continue with the physician. If the physician sees that you need to go back to the rheumatologist, then you go back to the rheumatologist again. That system can also work. Like where I was training in Israel, their system is like that. You see the rheumatologist once in a while, he prescribes what you are supposed to do, sends you back to the doctor on the ground, who continues to manage you until something changes, or he thinks that you should come back to the rheumatologist, then you come back to the rheumatologist. That is a public system which works very well. Israel's system of health is one of the best in the world. Yeah, and that's what they do. That's how they do it. Yeah, so the government can help a lot. Yeah.